I got my cup of coffee tonight. So maybe you're sitting somewhere quiet alone, or maybe you're doing dishes while the children are running around. Wherever you are joining us from, we welcome you, and we are so glad that you have chosen to join us tonight and spend your time with us. The Parental Guidance series is such a special series that we have been doing with UHealth Jackson Children's Care. And I have to say, if you are a first timer, please tell us, say, hey, we'd love to say welcome to those who are joining us for the first time. But if you have been with us before, then you know that we have dozens of these. So there's dozens that you can go back in the archives and watch and look at all the different topics that we have available, a number of different topics. So check those out at jacksonevents.org. And then this one also will be recorded, and we'll share it here in about a week. So you can send it on to someone else or go back and refer to it later at jacksonevents.org. So we are so excited. Without further ado, I think we should get started, because I believe we're going to have a lot of questions tonight. We are going to watch the clock and do our very best to respect your time as well as our expert, and we'll finish right at about 9 o'clock. So my name is Sierra Bregan, and I'm your host. I'm so excited to be with you here at Parental Guidance. I am the owner and founder of Miami Mom Collective, and we are Miami's premier parenting resource and community. So we have a community of moms. We host events for moms and families, and we also have a website as well as all the social media channels. So if we can ever serve you in your parenting journey in the city of Miami, we're here for you. We have all sorts of guides and resources. So you can find those on our website at miamimomcollective.com. And it is a joy to partner with UHealth Jackson Children's Care to bring these great resources to you. So I want to tell you a couple things that you may or may not be aware of. But the first is that the pediatric emergency rooms at Holtz Children's Hospital, Jackson North and Jackson West are all available 24/7. They're all staffed with board-certified pediatric emergency medicine specialists. So whoever is there, the parents and the kids, are having access to every pediatric subspecialist at Holtz from the University of Miami Health System, as well as the Jackson Health System. And the Holtz Children's Emergency Room is 24-hour kids only. So I hope you never need an emergency room, but if you do, Holtz Children is a great place to take your kids and not be, susceptible to everything else that happens in an emergency room. But and one last thing is that Holtz Children's, the doctors and the nurses are all certified in pediatric advanced life support. So you really are getting exceptional care. So a huge thank you again just to UHealth Jackson Children's Care for pulling these together. We literally bring you an expert in whatever topic that we're covering. And I think I have the best end of the deal because I get to sit and interview them and ask all the questions. But again, if there's a moment tonight where you have a question, you can drop that in our Q&A feature, and I will do our best to get it in front. So I'd love to introduce you to tonight's expert, Dr. Evelyn Benitez. She has been part of Jackson Health System for over 20 years, and she's been in the medical health field for over 3 decades. So she truly is an expert. And her clinical interests are in trauma, ADHD, which we'll be talking about tonight, as well as autism, addiction, chronic illness, and crisis interventions that are due to injury or accidents or loss or the loss of loved ones. So in addition, she has administrative and management expertise, and she's taken several leadership roles in the Department of Psychology and oversees the Jackson Behavioral Health Outpatient Services and is part of the administrative leadership team. And I have to say, she has such a heart for what she does. We were chatting earlier, and just I'm so excited to get in tonight because really you're going to see not only her expertise, but truly the passion that she has for this topic. So she is the Associate Chief of Psychology and the Director of Postdoctoral Residency Training. Clinically, she's involved in supervising psychology interns and residents, and she's also gives lectures for child psychology trainees, child psychiatry fellows, and psychology residents. So not only is she practicing, but she is helping and equipping others to practice as well. So I love that. I feel like you're passing it on, to the next generation. I think that's amazing. So she provides direct patient care supervision in the outpatient child and adolescent center and the child and adolescent acute psychiatric inpatient unit. And she's provided coverage as well for the pediatric health psychology services at Holtz Children's Hospital. So Dr. Benitez, you're busy. You're doing a lot of things, and I'm so thankful that you were able to take some time to be with us tonight. So welcome, and thank you for being here.
Thank you, Sarah, for such a welcoming and presentation. Thank you.
Well, I said it and I mean it. This topic is so important. I'm so excited to jump in. And so we're just going to go right in, and I'm going to ask you, let's start kind of big picture when we do the topic of ADHD. I think we kind of throw it around a lot, but talk to us about what is ADHD, and then why is the term ADD not used anymore? I kind of feel like I don't hear that as much. So talk to us about that.
Yes, wonderful questions. First of all, let's find out first what ADHD stands for. They're acronyms for Attention Deficit Hyperactivity Disorder. Now, ADD, which is Attention Deficit Disorder, was back in the 1970s, believe it or not.
Wow.
It was used way back when they wanted to combine kids that had problems with inattention as well as hyperactivity. So they decided to put Attention Deficit Disorder with hyperactivity or without hyperactivity.
Okay.
But in 1987, they combined and changed the name to ADHD with which combined both inattentive and hyperactivity and impulsivity, which is what we have now. However, some kids that are just have attention deficit disorder, a lot of people just like to say ADD. It's just easier than ADHD.
Right.
So that's why it kind of lingers around, even though it's been such a long time.
Okay, that's so interesting, because I will say, growing up, I would say probably 15, 20 years ago, I would hear the term ADD, 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 ADD. And so I kind of thought like it was a new thing, the merge of the two. So that's interesting that it was still quite a long time ago. Thanks for sharing that. Talk to us about, we're speaking, specifically tonight about parenting children with ADHD. So how does ADHD manifest in children? What does it look like? And do symptoms vary from child to child?
Yeah, that's a good question. I think one of the biggest and most important piece we need to know is that ADHD is a neurodevelopmental disorder. It's actually part of the brain that's not functioning as well. It's a disability. And I think we have so much research under our belt over the past 40 years. We've really improved on research with ADHD to better understand why is these kids presenting in so many different facets. So there's different severity levels, and I'll go into that. And right now, the way we understand ADHD, it's a couple of ways of identifying. It's ADHD predominantly inattentive presentation, which was the old ADD. ADHD predominantly hyperactive and impulsive, and ADHD combined type. And the ones we see most often are the combined type, and less often the ADHD inattentive type, because they take longer to show up. And I'll talk a little bit about that one too. How it shows up, reality is it could show up very early in infancy and toddler, and then it kind of shows up as it gets older, depending on the severity. So the more severe cases, you'll see it earlier on. These are toddlers, little kids that are very demanding, never ending, and we all know what it is to have kids, in some levels. But these kids were usually called ever ready bunny, that battery that's like the ever ready bunny.
Energizer bunny.
The Energizer bunny, yes.
That's right. That's right.
Kind of they have a motor. They're in from one thing to another. And although when kids are young and toddler, you'll see it's a little bit more. And we hope that it kind of evens out. However, in preschool, you start seeing it more persistent. You'll start seeing these kids having more difficulties with staying focused on a simple task. They're the ones running around, having difficulty staying on task. And so you'll start hearing parents or teachers telling parents that their child is a little bit different. They're not behaving well. And unfortunately, a lot of parents think that there's something wrong with them, that they're doing something wrong with parenting them. And yes, parenting is helpful, but these kids, it's beyond that. There's something in their brain that there's a delay in functioning. It's really what we call the prefrontal lobe, the part of the brain that tells us to self-control, tells us to stop, to wait, to look ahead. And it takes a long time to really create or develop the prefrontal lobe, but these kids have a delay so much more severe than the kids that have ADHD. So that's where it starts showing up very early on. Toddler, very demanding. Preschool, there's a lot of problems. Parents are hearing a lot of complaints. And then by the early elementary schools, when most kids are identified as having ADHD, because that's when they're really, demands are there to sit still, follow directions, stay on task for longer periods of time. And so by then, parents are usually saying, I've tried to have them grow up, I'll grow this, and still it's just hard. So that's when they'll usually go and seek help.
That's good. I love what you said too about, maybe a child who's acting out at school or whatever, and a parent thinks, okay, I just need to do more. I need to discipline more or train more or, positive reinforce more, which are wonderful things. But that would be challenging to know, or to think that, okay, maybe it's just a discipline issue. Or so if a parent is thinking, oh, maybe there's someone listening right now going, that's my child, and I haven't even thought about that. What would you say? Like, how do we confirm a diagnosis, and what would be the plan to seek treatment?
The first is making sure there's nothing medical wrong. Sometimes we first have to go to pediatrician, make sure they get their checkup, make sure there's nothing rare that might be happening that's creating some of this hyperactivity and attentiveness. That's most important. If the pediatrician feels like there's something that could be wrong in terms of seizures or epilepsy, they'll usually refer them to a pediatric neurologist. But if they don't see that, they'll usually will refer them either to a psychiatrist, a child psychiatrist, or a child psychologist. They each play different roles, of course.
Please tell us, because I think I mix the two. I think all of us are like, tell us the difference.
Oh, okay, great. Thank you for asking that. So the child psychiatrist, what they'll do is do a full evaluation, but they also will find out if the degree of their symptoms are severe enough that they need medication. So they'll do the evaluation, they'll assess. And again, with ADHD, you have to see the impairment, not only at school, but at school, at home, with peers. So there have to be at least 2 to 3 different settings, because that's some kids will act out in school and they may be having a learning disability, a learning disorder, or they may be anxious. There could be other different, or being bullied. So there could be a different reason for their acting out. But at home, there could be because there's other things happening at home. And so those things have to be ruled out. And the psychiatrist, child psychiatrist as well as child psychologist will do that. But the child psychiatrist will see if it's severe enough, they will then recommend medication. And so they're the ones who are really the ones focused with the medication. If it's not severe enough, or the parent does not feel that they're ready to have them seek medication, then they'll refer them to a psychologist who specializes with ADHD. And here, what we do is we assess to find out, again, another thorough evaluation, and find out if they really need medication. And there's different levels and degrees. I don't think I said that earlier. It's from mild, moderate to severe. In the mild one are symptoms that are there enough to be affecting the child at school or at home or with peers, but not so the degree that they may need medication. So usually when I see a child with mild symptoms, we really try to educate the parent with different parenting techniques, and also the child to understand what's going on, some of their levels of strength and challenges, so that they can better have the equipment, the skills to be able to confront them. And so they may never need medication. The ones that are moderate to severe, those are the ones that we try, at least from psychologists, when the psychiatrist refers to us, we try to do it, seeing them for parenting skills training, seeing the child to help them understand. But if it doesn't work after several sessions, it could be 2 months worth of treatment. If we still see it impairing, then we refer and recommend the parent, to re-seek a psychiatrist to see that. With severe, to be honest with you, when kids are very, very severe, and what that may mean and look like is these kids are getting expelled from school. They're fighting. They can't sit still. They literally can't sit still. Again, it's part of the brain. There's brain activity that is not connecting in a way that will make them understand, if you do this, this is a consequence. They just can't connect those things. So they're not doing it purposely, but it's so out of control. So even sitting in with a psychologist or a therapist specialized with them, they can't get it. They say yes, yes, yes. They go out the door the next day, they're doing the same thing. So the sense of failure that they experience is really, really painful if you ever hear them, because eventually no one wants to be around them. The kids don't want to play with them because they're disruptive, they are intrusive and things like that. And so those kids, I immediately, in psychiatry also, will immediately recommend medication, because those kids are now suffering more in so many different areas that it's non-beneficial to stay without. It's a higher risk without being medicated.
Wow. My heart, I like the compassion piece. You think, oh, like what if I have 4 small children and I don't know that any of mine have been diagnosed or whatnot, but I think I can't imagine if I'm like parenting a child towards a behavior that I think is just a defiant behavior, but it could literally be something neurologically, underdeveloped, or like you said. And so the importance of getting assessed, and evaluated. And you said you do that in your office. I do have already some parents asking, like, how can we get an appointment? How do you go about scheduling something like that? Do you reach out, like you said, to a psychologist or psychiatrist to get that assessment?
Yes, it's very important. Here at Jackson Behavioral Health, they could always call our assessment center and ask for a child psychiatrist for an evaluation, or for child psychology. And so they will be able to see them. But also with their insurance, they have to make sure their insurance, what providers are listed in their insurance. And if it's not us, it's important to ask wherever they call if these individuals are specialized with children with ADHD, because a lot of us may be more specialized with other type of disorders. So ADHD has a specific understanding, techniques in terms of parenting skills that are different from the average parenting skills, because it's a neurodevelopmental disorder. We have to understand it from that sense. So what makes sense for a parent, let's say with you with 4 kids, some of the things that we say with just general parenting that we all need, by the way, because it's hard, kind of learning how to manage every child and their personality and activity level. But when one child is really suffering, it has to be seen from an ADHD perspective. It's a disability. So we have to be specialized in knowing what type of techniques will work best for this child and the parenting of it.
Oh, that's
so
great.
That's what I would recommend.
Okay, thank you. Yeah, and we had someone who said, we already have 2. You and I were talking about this before we started, even about supply and demand in terms of like mental health right now. And, a parent said, we have 2 diagnoses, but we just can't get an appointment. Like, I imagine it's just so prevalent. And so, there's such a need. So I'm sure there's like wait lists or a way to get, so just call your providers, those of you who are watching, and just great tips, what you said, to ask the provider to be sure that they specialize. You said something earlier, the ADHD that can either be, very inactive in terms of, disengaged, and then there can be hyperactive, and then there can kind of be this mid-range. This is just a question that popped in my mind, but like that mid-range zone, is that someone just kind of can waffle back and forth? Like sometimes they can just be very disengaged and sometimes they can be hyperactive, or kind of what makes those fall there in the middle?
That's a good question. And let me make sure, in terms of disengaged, it's more inattentive. That means to be, more inattentive. They are just kind of, they can space out very quickly. They'll daydream. They also tend to don't pay attention to details. They're the ones that lose a lot of times, lose things. And as they get older, they'll lose their phones, their book bags are left somewhere in the park before. And so they're very, very absent-minded, and so those are the more inattentive presentation. Then there's a hyperactivity, impulsive ones. Those are very easy to recognize. The hyperactivity is a child that never stops. The party's over and they're still bouncing around, let's just say. And you're like, I thought they would be weared out. No, they're still bouncing around.
Bedtime, right? They won't give in.
And they won't give in because they do have a difficulty sleeping. Kids with ADHD do have difficulties going to sleep. Their brain just keeps on going, or the activity level that they have keeps going. They're easily bored. When things are finally like, we're all rested, we had a nice time at the park, in less than half an hour, they get this surge of energy and they're now bored. And everyone looks at them in their family, but you're bored and we're exhausted, but they just have a lot of energy. And then, so it's nonstop. Some kids present, and especially females present very hyperverbal. They're excessive talkers. They're always questioning, asking, and even when they're playing and talking out loud. So it's really interesting. And that is a different, mainly females present with more hyperverbal than males, but they both are very talkative. They tend to want to like to talk. They're actually very talkative. So these are the more hyperactive type of kids. And then the other, the impulsive ones are the risk takers. And again, they're all within the same thing. They're risk takers. I have kids that have fallen off, let's say, a table. They had to go to the hospital, let's say, and get stitches and everything. 2 days later, they're on top of that same table, dancing around, jumping. They don't connect. They don't see the risk anymore. There's no connection with what just happened. And that's very, very difficult for parents to understand, people to understand. So they're the ones that are always kind of the first ones who are jumping into the water. And when everybody's just staring and wondering, should we go jumping? And they'll jump in. And so we have to be careful. They'll cross the street without realizing. So their awareness, and what I look at it, or the research itself looks at it, is like they're 3 years behind in terms of developing these type of skills that you would think by 8 or 9, these kids should know they need to look both ways when they're crossing the street, and they don't. And they're still at the 5-year level, as an example, When I was talking about the middle ground, it meant more the symptoms and the severity of symptoms, So mild is less of the symptoms. It could be all 3 of these: impulsive, hyperactive, inattentive, let's say they're combined type, but they're not so many. And the moderate is that they have just enough, but not as severe. Where it's severe is really impairing very early on, impairing in all areas. And the moderate is kind of in the middle, and that's where, but they may all have the same in terms of hyperactivity, impulsivity, or inattentive type.
Oh, thank you.
Does that make sense?
Yes. I am feeling like we need about 3 hours. We only have 1 hour, and I'm like, we need like 3 hours for this. This is really great information, Dr. Benitez. And one thing I thought when you were saying, it's just lost me. It'll come back. But, I know what it was. A parent commented this too, just saying, I appreciate the compassion that you're sharing with, because it's very easy to, even just hearing you talk, just that last example of the kid running in the road or jumping on the table, to look at that as a parent and be like, why are you so defiant? Why is your behavior like, I'm doing something wrong? And to hear you say, to reframe, that it's literally a developmental disorder, and to know that there's an impairment there. Disability is the word that you use. And I think I've never even viewed it that way. I just kind of, this is a kid who's really hyper and they just need to get control of it, So I think you're paradigm shifting for a lot of us. So I appreciate that. If you have a question, I just want to remind you, drop those in the Q&A feature. I'm doing my best to keep up, but the chat kind of keeps going. So drop those in the Q&A feature, and I will get those in front of our expert here. Okay, a couple questions. And you alluded to this. You said that girls can tend to be talkers and chatty. What about, one of the questions we received was, how does it manifest differently in girls versus boys?
Absolutely. And that's a great question. Girls have been underdiagnosed for many, many years because they show differently. For the most part, they could be chatty, and that's very normal. It's socially, it's okay to be always talking and things like that. And they could be absent-minded and kind of disorganized because they're always talking and thinking of things. And so we just see it as just a girl thing, and not to worry. And sometimes eventually she'll grow out of it, which is what happens. But as they get older and the demands get higher, that's when we start really looking at, there's something wrong, because they can't stay focused. As much as we've tried to help, now they're 11 and 12 and they're still not able to make these decisions in terms of following directions, being able to complete a task. They get overwhelmed very easily, and it's really because they don't know how to break it down. Their brain doesn't know how to break things down in a way that could, at that age, at 12, you're expecting, as many parents are expecting, they should be doing their homework by themselves. They should know by now that we've given them, and they're not. They're actually now having more difficulties because they're not diagnosed. And that's when we usually get more of the young girls diagnosed at 12 and even older, believe it or not. They have a way of being able to compensate. And so a lot of times it's gone underground. The ones that are really picked up are the ones that are very hyperactive and just are more aggressive in their ways. And that's when we start seeing them. And again, anything with behavioral issues are always going to be seen in some fashion, either at school counseling, they're having difficulties, they're being taken out of school, and then they're sent to a counselor, a therapist, or a psychologist because something is not working in terms of they're doing at home or at school. So there are undiagnosed. It does show up differently, but boys tend to show up quicker because of their activity level.
That makes sense. And you mentioned, girls can kind of lay low just because maybe we kind of learn to overcompensate and whatnot. But one mom is asking, in her case, her daughter is concerned that she herself may have it. But she said, how can I help my daughter? She's 14. I don't see anything that really worries me, but she has some doubts and she wants to help her. Kind of what's the next, would visiting the pediatrician be the next first step, or would it be having an evaluation?
Those are both good steps. Always to see a pediatrician. We always recommend to make sure that everything's okay physically. There's so many things going on that we need to know first that everything's okay physically, and then to be seen by a psychologist. If they don't feel like it's at that degree, they could be seen by a psychologist that could evaluate and make sure. It could be an attention disorder, or it could be a learning disorder, or anxiety. There's a lot of things that overlap, and we have to be aware of that. And that's the teasing out. That's the exact questions that we have to ask to make sure. And sometimes, believe it or not, we can have ADHD and we can have anxiety disorder. And we can that's a very common thing, as well as learning disabilities. So if she feels there's something going on, she's experiencing something, it's great that she's saying something, because it could be subtle enough, but it's probably she's struggling so much that she's saying this is getting harder. And as school and the demands of school is getting harder, she might be feeling more of the impact.
Thank you. Thanks for speaking to that. So many great questions. I'm going to keep rapid firing them. I'm watching our time. We got about 30 minutes, so I'm going to keep them coming. But okay, so we talked about, some parents opt to medicate their children after a diagnosis, and others maybe choose not to. What advice would you give parents who are undecided?
Yeah, I think what I said earlier, you will see the difference in terms of when you go to see a psychiatrist or a psychologist. If they have mild symptoms or moderate, just kind of like that. It's that little range, right? That moderate, mild to moderate. People will try, and we will try as psychologists to see, let's just implement skills that can help you, and parenting skills that can help them. There are many that can help. But if you can still see that they're struggling, then that's where you have to reevaluate, for medication. Again, and things that I look at is how, without medication, how is it affecting their ability to focus, to complete their tasks, to learn? So all those base or blocks that they need in order to then achieve higher level of education, if they're missing, they're going to have a lot of holes in between their learning. So that's going to be affecting them eventually at the end of the school year or the next following school years, because they are not able to grasp it all.
That's right. I'm receiving several questions just about the hyperactivity and how do I, one mom, how do I motivate my son who's 6 years old? He's always getting notes home from the teacher that he was on red again, for his behavior. How can she help him with homework, strategies to help him stay motivated when he just wants to do 100 other things? What would be maybe overarchingly some parenting skills that can be helpful when a child struggles with hyperactivity or impulsivity?
Yeah, I think that some of the beginning techniques is really trying to get them to stay focused. And for little kids, just in general, but a child that has ADHD symptoms possibility, is to break things down and motivate them to say, break it down and say, let's see if they have a full page of math problems, let's say. Just do 3 of these math problems, and I'm going to give you a timer, and I'll come right back. So you get them focused. You need to motivate them because they think everything's a competition. That's another part of the brain. They need to be stimulated. So if you get it as a competition, as something fun and active, they will buy into it.
Yeah.
The only thing is that they can get bored very quickly. So don't always think that that thing that worked 2 weeks ago will work again the next week. So you have to be very creative as a parent. But that's one of the tricks that we say to parents, depending on the age, break it down, give them a time because they need to know, let's me focus on this. Then you come right back if you're able to stay away, depending on the age. And then you can say, great job, one sticker or one more, kind of point system. And then at the end, this is what you get. And either they get a little bit an extra treat or some time to be able to play outside or something like that. But they need to really structure it in a way that helps them manage their distractibility, because it's easily just to go often. And so part of their brain just gets easily distracted at a sound, something they saw, or just, this is hard. And to stay focused on a task and be persistent is one of their most difficult piece of the ADHD. They lose track and they just can't be persistent. Anything that's mundane, that's why novelty is so exciting and they like it, but then they get over it very quickly. So you have to be always very creative, but I'm hoping that answers a little bit of at least one structure in terms of homework, and having to break it down. In terms of school, I think, it's a little harder, but if they work with the school system and the teacher, if he gets kind of a point here, he'll get some rewards points. When they're young, the reward system has to be immediate. So that means when he comes home and he's got a yellow or green, we can start with yellow. And if they go through green, yellow, and red, if it's a yellow, at least he got one yellow, so he's doing better. So he'll get 1 point and another point, or a sticker, something that really motivates them, what they want to do. And it could be just going to the park after they get a lot of them, but they need to see it that day. They can't wait
to be like, in a week, we're going to go to the Dollar Tree. Yeah. It's going to be like that day.
It's got it. And the younger they are, the more immediate they need in terms of the reward.
That's good. I had never thought of it in terms of that. That makes sense with like the impulsivity. You need the reward to be a little, not impulsive, but immediate, because they can really lose that interest. This is fascinating. I think I'm getting so many comments like, this is great. Let's keep going. So thank you so much, Dr. Benitez. This is really helpful information. And we've got a lot of questions. We're going to keep going. And I will say the timer, we use a visual timer at our house and it turns blue and then it ticks away, but we got it on Amazon and it is so helpful for like, put your socks on before the blue runs out, just get us out the door. Super
wonderful.
Helpful.
What's one of the things that I'm so glad you said that. And I don't know if you have more questions, but I wanted to add on, our kids with ADHD do not have any concept of time. Time is now. That's why they can't wait. When you tell them they're going to do something in half an hour or later on, they'll say now, they don't know. It's either now or not now. So that's also a very important piece. You have to help them learn about time. So sometimes externalizing time is what you're saying. Tell me what time it is. Okay. And having a clock like that. So when it turns blue, that means everybody has to do this or pick up or, make it fun, but they need to start learning to grasp the sensation of time, because it doesn't filter in. It's everything's immediate.
That's good.
And consequences of that's why they can never think of the long-term consequences. It's just that this feels good. I'm having fun. What do you mean I need to eat? Or what do you mean I have to go to sleep? That's later. And so that's one of those most difficult battles our parents experience with kids with ADHD. It's a general battle of going to sleep and sleep time for all kids. But for these kids that suffer with ADHD, it's even 3 times more, because the urgency and when they're focused on one thing, it's kind of like focal vision. It's really interesting, because if they like what they want, they will focus in on it. Now, to shift them into something different is very, very difficult. So there's things to remind them. And some of the things is like the clock and timers is one of them.
Which makes sense why a kid would maybe rage if they're zoned into a show and then you click it off and say, time to go, like it would make any kid rage, but it would make sense why it's hard for a child with ADHD to cope in something like that, because they're in that tunnel vision moment. Wow, this is really good. Okay, more questions. Here we go. Okay, this is something for children with ADHD. What are the best outside of school activities? Like, are there certain maybe extracurricular activities that could help them, or is that kind of unique to each child?
It's a combination. It's unique to each child. You have to find what they like. It's definitely good to start with having some activity that's physical and that they can start learning how to play with other kids and learning how to follow rules, but they really need to enjoy it, the type of sport, whatever activity. So some kids really gravitate to football or soccer, where they're running a lot, or basketball, but others like swimming. They like the individualized things. So we have to know our child and what they like, and they could try it out. Some of the kids will start feeling if they're not coordinated well, or they can't hear and listen, so they can't follow directions. So they fall behind in a team environment. So we have to be watchful for that, because they can just go drift off, and here's the coach giving what you're supposed to do, and they may drift off. And so then they start feeling embarrassed and not good enough, and they don't want to go anymore. So you'll hear the tantrums. I hate that. I hate that person. I hate that teacher. Understand that it might not be them wanting to give up easily, or they're just bored. It's really something to do with their self-esteem. They're now seeing that they can't keep up with the group, and it's because they're having such difficulty. So we have to keep an eye and be very receptive, and also have a coach that knows how to use much more positive reinforcement versus the kind of a hardcore core coaches. Those hardcore coaches, sometimes kids don't always gravitate very well. We also have to know our children. Some kids need that to but a lot of kids then start feeling if they're more sensitive, they start feeling kind of like they'll never be able to succeed, and they're going to kind of feels like punitive. So you have to also know your child in terms of what activity and the type of coach that could really do well with a child. Kind of like teachers, but at least in outside activities, we can choose these coaches and activities, versus teachers. We have to hope that they understand our child.
Oh, I feel like we could do a whole episode on, seeking support in the school system. Could be a whole nother episode. But, one thing you spoke to earlier too, just about they're unable to see the long-term implication, which I think is scary. I mean, and can be very dangerous in a lot of ways. You think if a child goes undiagnosed, or is just like, oh, they're just have bad behavior, they'll grow out of it, or they're just hyperactive, he's a boy, he'll grow out of it. That could have really serious mental, physical implications in the future. I imagine it's very enlightening, all that you're sharing tonight, and it's hugely helpful.
Right, thank you.
A couple of you are asking about the Amazon timer clock. If you go on Amazon and you just search visual timer, a ton of different ones will pop up, and it's basically where you turn it, and it maybe you turn it to 10 minutes, it'll give you 10 minutes worth of blue, and then the blue will start slowly disappearing. But if you just look on Amazon under visual timer, you can find that there. So hopefully that will help some of you. Okay, some more questions. If a child is diagnosed at maybe, we have one parent who said a child is diagnosed at age 7, he's now 12. Should they have him tested again, or once a child is evaluated, is that sufficient for a diagnosis?
Yes. The difference is that he might have been, if he's gotten medication or he's been in therapy, he's gotten better. So the medication you don't need as much medication. I think that's also a key point. Medication helps, but we need to have them learn the skills to help themselves, as well as the parents need to learn the skills, because if not, what we found many times is that then we need to increase medication, because the management of the behavior, they haven't learned any tools. So the medication, they become more dependent on just medication, and it's only so much you can go. So we don't need a reassessment necessarily, unless the parents are now questioning, it could always be reevaluated, but it depends on the question. I guess it depends on what they're showing, what they're concerned with. But if they've ever been without medication, let's say Usually a lot of parents don't give medication during school, summer break. And then they see, oh, okay, now I know, I see my kid again. They're all over the place, but it's okay because they don't have to wake up early. There's no rules. They don't, the structure is a much more open, but they can see that. But if they're finding that their child now is 12 and without medication, they're pretty easygoing and, they're not that impulsive or hyper, but they may have inattentive type, but you have to really detect that. And that's where testing is helpful. They may want to have another follow-up. That it wouldn't hurt.
Right. When you said ADD and ADHD have been kind of put together and saying that there's that inattentive and then the hyperactivity. I'm learning so much. Do you see a percentage of like most are this and most are this, or is it a pretty, even split in terms of it's due to inattentiveness and it's due to hyperactivity?
I really don't know. The research right now it's showing, and there's a lot more concentration on kids with hyperactivity and impulsivity. The AD inattentive type, they're really finding a different type of part of the brain. It's called the sluggish temporal brain. There's a part of the brain that they're saying we may need to change even the ADD or ADD inattentive type into concentration disorder, because they're finding there's something else about this part of the brain that's and why I call it sluggish is that there's just there's lack of motivation. There's something slower processing in terms of what we see with kids with inattentive type, that we think, oh, they're lazy or they don't want to do anything. They have a mess all over. And it's just there's something more in the brain, and there's more research to come. All I can say is just anyone who does have a child with ADHD, to keep up with the research. There's a lot. Make sure it's research-based, science-based, because there's a lot out there with different types of remedies that are not always the most scientifically backed up. So make sure that they keep up with it.
Oh, that's good. That's good. We actually had a parent ask if you had heard of the Calm Parenting podcast, that it's supposed to be helpful for helping, parents of kids with ADHD. And they said, we're a bit skeptical, but have you heard about it? Would you recommend or not?
I haven't heard the Calm podcast if it's for ADHD. I don't know if it's just really learning how to remain calm as a parent and learning how to address their child more in a calm fashion, which is helping their child to be much more mindful. Those are techniques that are being shown that are helpful, teaching kids how to relax, teaching kids how to concentrate from a mindful perspective. So I don't know enough about that podcast, but if it's going in that direction in terms of helping parents stay calm, which is so important because these kids are exhausting. They don't stop. They have so much energy, and you think, okay, am I getting too old? And it's not. It's that they have much more than the average
very quickly.
So it's not. Neither one's their fault. But it's important because then, if we're stressed, if we're tired, if we're not sleeping because they're staying up late or they wake up very early, we have to look at how do we take care of ourselves. So if it has any reflection on that, I would recommend it.
That's great. That's great. Okay. Getting questions. People are asking, does your office, do you do a psychoeducational evaluation? What's the time frame to complete that? And is there any availability or do they just need to call the office?
Yeah, well, let's just be, in terms of psychoeducational, that is under a school environment. That means the schools are ones. Yes. So psychoeducational is basically an evaluation to find out their IQ, how they think in terms of how they learn, and if they have any learning disabilities and things like that. And in that process, they can see if they have ADHD. That's psychoeducational, and it's very based for school, or school-based. Now, psychological evaluation has the clinical aspect. That means there's something else going on that's questioning. Could it be ADHD, anxiety, something else within the child that's causing the ADHD? Is there an IQ? So that's psychological testing, and that's and also there's neuropsychological testing. Is what part of the brain is being affected? Where are the areas of strength? What are the areas that are weaknesses? And it's a lot more focused on that part of the brain that could be affecting more of a child because we don't know. So that's neuropsychological testing.
Okay.
The school system is the ones that do the psychoeducational or school psychologists in private practice. Psychologists in private practice here too. There's a long waiting list, of course, but we do it too. And then there's neuropsychologists, pediatric neuropsychologists within private practice. We don't have one here at Jackson, but those are good, different ones. The school system does it for free, psychoeducational for free, but there is a waiting list there too.
Yeah. I have a feeling your office is going to get some calls tomorrow. Also, on that note, we have one mama who said her child was diagnosed this summer with ADHD, and the psychologist recommended occupational therapy, but their insurance doesn't cover anything in Miami. So could they visit someone like you and just pay out of pocket for services? Do you think that is? I mean, I guess talk to us about the difference of like seeing occupational versus like a psychologist.
Oh, okay. Yeah. Not sure the reason for occupational therapy, unless there's something with fine or gross motor issues, I imagine. With psychology, it's much more skill-based. How do we think and how do we act and how do we feel? We help children understand to stop and listen to their thoughts, to see how they can stop themselves. There's techniques to teach them how to understand what's going on when they just go so impulsive, and just over and over repeating techniques, and also understanding their personality in order to help parents to say, these are the skills, parenting skills. Try to work with, try to work with your child in his personality. That's a different. Sorry, I got to.
No, you're in such high demand. I'm telling you, someone walked in your office. They said, "Forget it. I'm getting off the webinar. I'm going to her office right now." I'm teasing. No, that's great and helpful. But someone could see you if they need a psychologist and just pay out of pocket. You don't have to have the insurance. Obviously, the insurance helps, but you also can just pay out of pocket for services. Is that correct?
Yes. We would have to ask, because we work at Jackson, and it's a outpatient system. They would have to call and find out, and I'm sure they will accept it.
This is good. Do you see, on that note, I've got my brain is a pinball of questions for you. Okay, you were speaking about OT versus psychology. Now, a lack of emotional self-regulation, like those sort of skills, is that psychology? Yeah.
Yes.
Okay.
Very much so.
And is that connected to ADHD? I would assume can be. Yeah.
Absolutely. I'm so glad you asked that, because that is part of the brain, the prefrontal brain that I was saying earlier, that it encompasses the executive functioning. It's the one that tells us to stop, to see how kind of self-awareness, to persist in tasks that are boring. And that part of the brain, which is the prefrontal brain, does not have the activity that we need or the connections. And so emotions are really very intense for these kids, for many of these kids. Again, those are usually the ones that then turn into having anger outbursts, rages. They get into fights a lot, and it's just that they go from 0 to 60 very easily. Anything can trigger them, and it's really frightening for them as well as their families or the people around them, because they don't have a stopping gauge. And yet, sometimes with medication, and also helping them and their parents help with how they function, to think before they act. But it's not so simple. It really takes a lot of work.
Mm-hmm. Here's a question along the lines, we were talking about OT. One mom shared that they, went to OT for sensory sort of issues, but the strategies there didn't seem to help. Would you suggest that kind of the next step would be to do that evaluation, that perhaps it's not just you need to practice these, parenting strategies. It might be that you need some more support. Your child needs more.
Thank you. Yes, I think that's a great option, because in terms of sensory, some of our kids are sensitive, and they have found that it helps them in order to calm down and to learn how to relax, but it's not always successful. So it would probably be better for them to be seen by a psychologist or a child psychiatrist to see what could be other options.
Yeah. I'm firing them at you fast because I want to get them all in. We got like 10 minutes left, so I'm gonna bring them fast. Okay, I know that autism is one of your specialties as well. One mama asked, how common is it to have ADHD condition with ASD? is there a difference in the treatment for these kids with a combined diagnosis and, maybe one is more dominant than the other?
Yes, and exactly that's true. One is more dominant than the other. Kids with autism have much more difficulty with connection. So that's another part of the brain that don't connect. And so they could have ADHD because of their distractibility or hyperactivity, impulsivity. They overlap so much. And so sometimes if they're high functioning, they have a lot of inattentiveness. So there's autism, but at the same time, they have the ADHD. Treatment is pretty similar because they overlap. We would treat which one's the symptom that's more severe.
Okay, great. Thank you. So many questions I'm getting. Okay, poor time management and anxiety in teenagers. Can this be a sign of ADHD? I want to say yes by what I'm learning tonight, but you're the expert.
So poor time management. What was that? The other one?
Anxiety.
Anxiety. Anxiety could be poor time management too. It's they get overwhelmed. They don't know where to start. It overlaps. It's a good idea to get it checked. And if it's just anxiety, it's also good to find out how to help them when their anxiety hits and they can't function. Yeah. So.
Okay, great, helpful. Okay, let's see. Oh, there's so many. Okay, one viewer asked, let's talk about, are there any kind of natural or homeopathic things that you would suggest people trying? Like someone asked about a magnesium supplement. Do you think that's helpful? Or since it is a neurological thing, speak to us about that.
Yeah, I have to stay a little bit reserved with that because there's got to be science behind that. I know people try all kinds of things. I know magnesium is one that is out there showing some help with even sleep in terms of helping kids with sleep. But I would have to be, I have to reserve because that's not my scope, of knowledge. And so,
yeah.
No,
great.
There's just a lot. They just have to be you have to be careful.
Yeah, I understand. Okay, you talked about we can see signs of ADHD as early as infancy and toddler, but at what age can a child, like how young can a child be diagnosed?
Usually by the age of 4 or 5, it's pretty apparent. And we could see it. We can try to do some management, but usually by 4 to 5, you could see it if it's that severe. And again, it's only when the task becomes much more demanding at school is when you're starting to see it, and it's a real clear diagnosis. But some of our kids at 4, it's very, very, very apparent.
And you may have spoken to this prior, but refresh us. The best test route, neurologist versus psychologist, or would you one over the other? Or?
As long as there's a child psychologist that does testing and are experienced with ADHD, I would recommend that. A neuropsychologist, a pediatric neuropsychologist, they're just much more fine-tuned. So if there's anything that's of concern that they may have, anything of brain damage that they're worried, they had a car accident, they had a concussion, they would usually need to go to a pediatric neuropsychologist. They'll do more specific testing. So it's not necessary. It's more expensive. It's much more detailed. So I would opt that if that's needed. But there are psychologists that will do testing for ADHD. So it's just a matter of asking.
Yeah.
They're both good as long as they work with ADHD kids.
That's great. And we talked a little bit about medication. Talk to us about the science maybe, or like how it actually works. In the brain and for the child.
So it's interesting. What the most common one is being used as stimulants. So it's helping the brain to kind of activate the part that's very slow, not connecting. And so that's why when you give a child a stimulant, they're able to have kind of the brain activity that's needed in order to stay focused, and that part of the brain is not. Now there's much more medication, and again, it's out of my scope, but there's much more medication that's non-stimulants that some kids are doing better with because it's hitting another part of the brain. We have so much to learn still about ADHD, but we're getting a lot closer in terms of what medication may help depending on how they respond to stimulants or don't respond to stimulants. To tell you the truth, there's over 40 years of research with ADHD, so we're coming a long way. But I think we're hitting the right directions in terms of understanding much more about the medication and the management of it. So just that's why I'm saying keep alert to it and informed, because it's really important.
This is great. I feel like we're going to need a part 2 to this, because I don't know we're going to get through everything tonight, but I'm keeping them coming. Let's talk about, this is important. How do you talk to a child, who has ADHD without, how to explain to them, in an easy to understand way that what ADHD is without making them feel, insecure or different or.
Yeah. That's really wonderful. I think the most important part, depending on the age, I think when they're starting to struggle a lot and their kids don't want to be around them because they're always fighting or, then they're getting evaluated, you might want to tell them, we're going to be seeing a doctor. We're going to see what's going on. I know you try your very best, and you'll see, for the most part, kids really want to do well. They want positive attention. Yeah. And so these kids are just not getting any positive attention. So you could go as simple as, there's something going on with your brain that's not working as fast as we need to in terms of connecting, like we would, you like other kids that you can see. But you're not alone. There's a lot of kids that have this. There's a lot of famous people. So I would have, depending on their age, famous people that they can connect with. If they're with, in sports, they'll connect with people that have been diagnosed with ADHD and they've overcome it by learning these techniques. But the same part is saying, like, some people have something wrong with their eyes. It's not their fault. It's just that there's things that they have to work on with their eyes. I also say there's kids that have difficulties with having diabetes. They can't have sugar. And very early on, they can be diagnosed with that and they can't have sugar. There's nothing that they did to their body if their body didn't work. So this is a part of the brain that is just not connecting as quickly as you would want. And so that's why you're having difficulties with staying focused and things like that, or being so hyperactive and talkative and everybody's telling you to be quiet. So we're going to a doctor to see how we can help you. It's not going to make it okay to have bad behavior. That's no excuse for bad behavior. Okay. But when you do things that are not okay, we're going to work together to understand how to help you to help you do better with it, So it's also so important to say, okay, now because some kids say, I didn't take my ADHD medication. That's why I did that. And I'm like, okay, I hear that. I understand, but you can't use that as an excuse.
That's right. Okay, I'm going to try to squeeze in 2.5 more questions. But a common issue among parents of children with ADHD is that their child doesn't complete the task or chore. I know we talked about the visual timer, kind of the inverse of that. What are some helpful strategies when addressing non-compliance and like rule breaking? What are some strategies you would suggest?
Yeah, I think they're always motivated with privileges. So depending on the child, I think the main part here is make sure that we're giving them positive attention. I think we're so busy as parents in general. Our lives are very busy. They are very busy, involved in things. And all we do is giving them attention when they're doing something wrong. So I would first go into trying to pay attention to the behavior that you do want from them. So it's that they happen to pick up and put the towel back into the bathroom, so it's, hey, great job. Thanks for doing that, and it's those simple things, because if you can give them at least 5 recognition a day before you give them 1 negative, it would be wonderful. But we do the opposite.
We kind of credit all day and we need to be depositing.
Yeah, at least that, so that then they feel like, then there's a little bit more of a relationship that they want to cooperate. They see that you really care about, you're listening, you're seeing them doing well, or listening to how they said something and they said, hey, you didn't curse today. That's a great job. Thanks. You were in front of your family member and you didn't, recognizing these little small efforts that they do, and they didn't even recognize that they did. But if you recognize them, they're like feeling, you're starting to at least build something positive about themselves. So that's one thing. So I always go first for the route of making sure, because they're always hearing what they're not doing right. They're always these kids get more punishment and more reprimand than the average child. So we have to understand from very early on in their lives, So they're so used to just not doing well. So many of them just give up. I'm not going to finish anyways, because they don't even have faith in themselves, and neither do people around them. They're always, so we have to, that's one of the things that we have to really stop ourselves and say, okay, what am I going to do different for me as a parent? I am a parent with a child that has a disability. This is not because of poor parenting. That's a very important piece. There's a disability. Now, the difference between parents that don't learn how to manage their child will have the possibility of having these kids to have behavioral problems and aggressive problems. That is researched in terms of you have to do something different, because the more we just tell the kid how terrible they are, we give up on them. We'll say, okay, you don't do anything, so we won't rely on you. You are going to create someone that will either act out or feel worthless, and then there's some depression will come into play. So it's very important to make an effort to say, okay, I have a child that has a disability like any other disability. So if they have diabetes, if they can't see well, and they're, let's say they happen to be blind, what do I do as a parent? I will be now there. I will help them. I will learn about it enough to be able to help them, not to enable them, but to say, to guide them, and be proactive for them so that they can learn, these are the skills. I'm going to send you here with this doctor to help you with this. Let's learn about this medication, So also learn that effort, and to make the effort of trying to focus on some good things, at least twice a day, if anything. Say something nice to them. Say something about what you really value about them. Find that little piece and start letting it grow. And then you'll see some more compliance and cooperation.
Dr. Benitez, that's a good spot to end. I was going to ask you, my last question was going to be, what role does the parent's perspective play in our parenting approach, and what recommendations? And I feel like you just nailed it right there. We are our children's number one advocate. And I think just want to commend the dozens of attendees who are watching tonight and those who will watch later, as you're doing that by being here tonight, by learning these skills, by investing in sharpening, the tools in our toolbox to love and serve our children. So I'm going to put up a few resources here. I wish we could have gotten through all the questions, but you can screenshot this and continue, further study on your own of this topic. Expertkidscare.org as well for Jackson info. And again, jacksonevents.org. This webinar, as well as many others, will all be there in the archives. Give us about a week and we'll get it up, and then you can share it with a friend or a spouse or a teacher, maybe even your child's teacher. That could give some insight if your child has been diagnosed. And I would just say, if there's a parent watching tonight that maybe you're thinking, oh, wow, I've never had my child assessed, and after hearing all this, maybe I should. And I know it can be discouraging if there's wait lists and this and that, but no one knows your child better than you, but there are professionals that can help us understand our children. And man, if we can get great resources in our hands to love and serve our children better, I think all of us as parents would do whatever we could to do that. So Jackson is, of course, available to you if they can be a resource. Miami Mom Collective is available to you if we can be a resource. But just thank you for spending some time with us tonight. And Dr. Benitez, thank you for your time and your expertise. I think it was super engaging, a lot of great content and a lot that we didn't even tap into. So maybe we'll have to have you back soon.
Okay, thank you. My pleasure.
Thank you so much. I hope everyone has a wonderful evening. Good night.